So good morning everyone. So we are the group 12 and we are going to discuss about the peripheral vascular system. So the peripheral vascular system is a continuous network of blood vessels that carry oxygenated blood away from the heart into the periphery and carry the oxygenated blood back to the heart and to the lungs for reoxygenation. So ang peripheral vascular system is sila yung nagdadala ng oxygenated blood away from the heart and to the periphery, and sila din yung nagkikarry ng or nagdadala ng deoxygenated blood pabalik sa heart and to the lungs para sa reoxygenation. So this system is important in the perfusion and oxygenation of tissues and the periphery. So if itong system is hindi mag-function ng maayos, perfusion issues can arise like the hypoxia or the low amount of oxygen in the body and the tissue damage. So all in all, the peripheral vascular system includes all the blood vessels that exist outside the heart. So we have the main components of peripheral vascular system: the arteries, veins, and then the capillaries. So first is we will discuss about the arteries, that it is a vessels that carry blood away from the heart into the periphery. So ito yung nagdadala ng blood palayo sa ating heart and then to the periphery. So these vessels that carries blood in high in oxygen content away from the heart and to the farthest reaches of the body. So since blood in arteries is usually full of oxygen, the hemoglobin in the RBC is oxygenated. So blood in the arteries is referred to as arterial blood. Why? Because the resultant form of hemoglobin or the oxyhemoglobin is what makes arterial blood looks bright. So take a look at this. Itong bright red is yan yung artery or arteries. And then so what the arteries are carrying away is blood from the heart. So next is the veins. Vessels that carry blood back to the heart from the periphery. So they are the blood vessels that carry blood low in oxygen content from the body back and to the heart. So sila yung dadala ng blood pabalik sa heart and then from the periphery. So kung yung arteries is nagdadala palayo sa heart, ito namang veins is sila yung nagdadala pabalik sa heart. So the oxygenated form of hemoglobin or the oxyhemoglobin in venous blood makes it appear dark. So blood in the vein is referred to as a venous blood. So veins is also part of the afferent wing of the circulatory system, which returns blood to the heart. So unlike the arteries, venous network is a low pressure system since there is no force to propel the blood. So 70% of the blood volume is all contained in the veins. So next is the capillaries. So the capillaries are small blood vessels that connect the arteries to the veins. So etong capillaries naman is siya yung nagko-connect ng arteries to the veins. So ito siya. And so they are the smallest blood vessels in the body, connecting the smallest arteries and to the smallest veins. So these vessels are often referred to as microcirculations. So approximately 5 micrometers in diameters. So the purpose of central rule of capillaries is nagde-deliver ng oxygen in the blood to the tissues, and they pick up carbon dioxide to be eliminated, and they are also the place where nutrients are delivered to feed all of the cells of the body. So ang capillaries is they deliver blood and its components such as the nutrients and oxygen to tissues throughout the body and to transport waste products. And then their main function is to facilitate the exchange of materials between blood and body tissues, example, the muscles and the kidneys, and then the liver. So if all the capillaries in the human body were lined up in a single file, the line would stretch over 1,000 miles. From the capillaries, blood flows into the smaller venules and then into the veins, flowing back to the heart. So, to make it short, the arteries is they carry blood. They so the arteries is they carry blood away from the heart, and then to the periphery. While the veins is uh, uh, they they carry blood back to the heart and then from the periphery. And then itong capillaries is siya yung nagko-connect ng arteries and then veins. So next is the comparison of the arteries and veins. So ito yung mga characteristic nila. So direction of blood flow, yung arteries is conducts blood away from the heart, and then yung veins naman is conducts blood toward the heart. So ang kanilang general appearance is yung arteries is rounded, and then yung veins naman is irregular and often collapse. Ito. And then the pressure is yung arteries is high pressure, while the veins is a low pressure. And then yung wall thickness is thick, and then yung arteries is thick, which is makapal, and then yung veins is thin, manifest, and yung arteries is higher in systemic arteries, while the veins is lower in systemic veins. So opposite. So the relative oxygen concentration is lower in pulmonary arteries, and then mababa yung arteries, and then sa veins naman is higher and pulmonary veins. So valves is sa arteries is not present, while sa veins is present most commonly in lips and veins inferior to the heart. So the assessing the peripheral vascular system will be discussed by Abdullah, and then the disease related to the peripheral vascular system will be discussed by Abdulazis Amrina.
Assessing peripheral vascular system. We have here the subjective data, which you will ask the client about the health history questions. First, we have the leg pain or cramps. So ask the client if there's a leg pain or cramps during walking or exercising. Next is the skin changes on arms or legs. Ask the client if may napapansin siyang discoloration or any changes sa arms and legs niya. And then, next is the swelling. So, ask the client if namamaga ba yung kanyang mga paa or minsan ba is namamaga yung kanyang arms. Next is the lymph node enlargement. So, ask the client kung minsan ba is lumalaki yung kanyang mga axillary or sa bandang neck or sa femoral. And then, next is yung medications. So, ask the client if nagtitake ba siya ng any medication na pwedeng magka-result ng vascular health problems. And then we have here the objective data, which is the physical examination. Number one is preparation. So in preparing for physical examination, you have to introduce yourself first, and then explain the procedure to the client, provide privacy, and prepare the equipment needed. So equipment needed, we have paper tape measure, blood pressure cuff, stethoscope, Doppler ultrasound stethoscope. Inspection and palpation of legs. Number one, we have the skin and hair. So you have to observe if there's any discolorations on the skin, and of course you have to observe the distribution of hair. Next, we have the symmetry. So observe or inspect or palpate the symmetry of the legs, the hair, and also the size and the shape. And then next is the calf muscle. So you have to palpate if there's any enlargement, and also in the inguinal lymph nodes. And the next is palpating the femoral pulse, popliteal pulse, the posterior tibial pulse, and the dorsalis pedis pulse. Observe for any weak or bounding pulses. Next, we have the pretibial edema. So observe for any edema or swelling on the legs. And then lastly, we have the leg veins. So assess the veins on the legs while the patient is standing. And you can also apply or perform the manual compression test, which you will press on a certain vein and observe if there's any reflexes or a vibration or a wave. So Number two, we have in the physical examination is we have to inspect and palpate the arms. So first is the skin. Of course, you have to note if there's any discoloration or a pallor or cyanosis. Next, we have to perform the capillary refill test. So by performing capillary refill test, you have to press on the nail beds and then observe if mabilis bumalik yung color ng nail. So if hindi, then um, maybe there's a problem in the blood flow on the fingers. Next, we have to assess the symmetry or inspect the symmetry of the arms, the size and the shape. And then next, we have to palpate the radial pulse, the ulnar pulse, and also the brachial pulse. So you have to take note if there's a weak pulse or bounding pulses. And then next, we have modified Allen test. So in performing modified Allen test, you have to instruct the client to fist the hand while you are occluding the radial and the ulnar pulse. And then you will observe if the color on the palm will return within 5 seconds. Abnormal arterial pulse and pressure waves. Number one, we have slow, weak pulse. It indicates a diminished heart rate and force of contraction. Number two, we have large bounding pulse, suggest a forceful heartbeat with increased volume of blood ejected. Number three, we have the bisference pulse. It is a pulse with two palpable systolic peaks, often seen in aortic regurgitation or hypertrophic cardiomyopathy. Number four, we have the pulsus alternans. So this is the alternating strong and weak pulses, indicative of left ventricular failure or severe myocardial dysfunction. And then number five is the bigeminal pulse. This is the alternating strong and weak beats, resembling the patterns of a premature ventricular contraction. And then lastly, we have the paradoxical pulse. It is a decrease in pulse amplitude during inspiration, typically seen in cardiac tamponade or severe obstructive lung disease.
Disease related to the peripheral vascular system. First one here is the peripheral artery disease or PAD. PAD occurs when plaque builds up in the arteries, narrowing or blocking blood flow to the legs, arms, stomach, or head. It is typically caused by atherosclerosis, a buildup of plaque in the arteries which can restrict blood flow. So the symptoms may include leg pain or cramping during physical activities, numbness or weakness in the legs, sores or ulcers that don't heal, coldness in the lower leg or foot. So the risk factors including smoking, diabetes, high blood pressure, high cholesterol, and aging. The second one here is the peripheral venous disease. So PVD involves problems with the veins that carry blood from the limbs back to the heart. So the condition like deep vein thrombosis or DVT, venous insufficiency, and varicose veins can fall under PVD. PVD refers to conditions affecting the veins in the arms or legs, leading to impaired blood flow back to the heart. So the symptoms may include like swelling, heaviness, aching, and visible veins that are twisted and bulging. The third one is the Raynaud's disease. Raynaud's disease is a condition where small arteries in the fingers and toes constrict excessively in response to cold temperature or stress, leading to reduced blood flow. This can cause the affected areas to turn white, then blue, and finally red as blood flow returns. Symptoms including numbness, tingling, pain, and sensation of cold in the fingers and toes. The fourth one is the Buerger's disease. Buerger's disease is the rare condition that causes inflammation and clots in the small and medium-sized arteries and veins in the arms and legs. It is primarily affected young male smokers and can lead to tissue damage, ulcers, and even gangrene in severe cases. Symptoms include pain, tenderness, and swelling in the arms or legs, along with diminished blood flow.
So the last one here is the varicose veins. So varicose veins are enlarged, twisted veins that usually appear in the legs and feet. So they occur when the valve in the veins weaken or malfunction, causing blood to pool in the veins to become swollen and distorted. The symptoms may include aching, heaviness, throbbing, visible and bulging veins. So these diseases can have significant impact on quality of life and may require medical management, lifestyle changes, and sometimes surgical interventions to alleviate symptoms and prevent complications.